One of the questions I get a lot is, how do I know when my discouragement, when my depression has gone from just feeling down, just the common, ordinary, once-in-a-while blues that almost everyone experiences, to something more clinical, more serious, that could really affect me, my family, and those that care about me? And I would say there are some clues. Let me give you some tips, some things to look for. The first one would be sadness. If you're experiencing sadness that goes beyond what you would normally experience, lasts longer, maybe 2 weeks or longer, and is a little deeper, or maybe a lot deeper, than you've experienced in the past, that would be a clue. Most people that are depressed have some type of sleep disruption. Some people sleep too much, some people sleep too little, but the most common complaint from people that are depressed is that they sleep long hours, but wake feeling unrested. Many times you will lose interest in things that used to bring you pleasure, a regular bowling night, a poker night, a social gathering, church events. You just don't care anymore. You just have lost interest in things that used to bring you pleasure. In fact, that condition is called anhedonia, which is kind of like the opposite of hedonism. It's technically described as an inability to experience pleasure. And that's what you kind of feel like. You just don't get any pleasure out of anything. People that are depressed very often feel guilty about everything they've ever done in their life, and even some things that they haven't done, that they had no control over. They will ruminate incessantly about perceived past failures or current failures, and think a lot of thoughts like, boy, if I had only done this, or I could have done that, and things would have been much differently. So they feel things would have ended differently. So they feel very guilty about things. Depressed people typically have low energy. So you're not going to be as energetic if you're depressed as you were in the past. You're also not going to be able to concentrate as well. So if you work, your work is going to be affected. You will not be able to absorb and retain information in a way that you did when you were not depressed. Your appetite, generally affected. Some people eat too much, some people eat too little, but more often than not, depressed people run to the comfort foods, which are high fat and high sugar. And so you feel good, you get that little spike for a while, and then you do the sugar crash thing, and you feel guilty about eating the gallon of ice cream, and so you comfort yourself by eating another gallon of ice cream very often. Your physical affect very often changes when you're depressed, and it's not always what you think. These are called the psychomotor abnormalities, and some people that are depressed move toward what is called psychomotor retardation. And that's typically what you would think of when you think of someone who's depressed: the collapsed posture, the shuffling gait, the slowness of movement, the slowness of speech, kind of like Eeyore in the Winnie the Pooh cartoons. But other people go the other direction when they're depressed, believe it or not, to a condition that's known as psychomotor agitation. People that are agitated reflect kind of what it sounds like. They'll be picking at their clothing, unable to sit still. Sometimes they'll bite their fingernails until they bleed. So psychomotor agitation actually can be a symptom of depression. And then, of course, the final symptom, and perhaps the most serious, is there's a lot of suicidal thought and behavior associated with depression. So if you're having any kind of suicidal thought, behavior, you're actively suicidal, you've got a plan, you're able to talk about it, or maybe you're just being passively suicidal, where you just have stopped caring. You don't take your medication, you don't take your blood pressure medication or your diabetes medication or your kidney meds that are helping you sustain a good quality and purposeful life. Well, that could be suicidal type behavior as well. Or you've thought about harming yourself, cutting yourself, taking some pills, getting someone's attention, like you really want someone to understand how bad you're feeling. That would be a clue that you're struggling with a depression that is in need of some professional intervention.